Good afternoon. You're here live with Dr. Gary Lee at Elevation Health. I'm here with Dr. Carmel Ferreira. She's our naturopathic physician that works here in the office with us. Great family doctor. She's been with us for about a year now here at the clinic, and we just overjoyed to have her. It's been a pleasure to have her working here with us. When she started here, she was having some neck problems. I'll let her explain a little bit about that in a moment. But we started the type of treatment that we do here in the clinic, which is called chiropractic biophysics. The study and the nature of that is to correct the abnormal postures that causes the aches and the pains and the degenerative changes that we end up having as we go through life. So rather than ignoring those things or covering them up with drugs, we like to go in and correct them so you get normal function and the symptoms go away. So anyway, I'm going to give her a moment then to go ahead and talk about how she felt initially when she started and what's happened since.
So when I initially started, I have to say I was not really thinking it would help much because I had seen various chiropractors. I was experiencing, for one, just severe neck tension, always on the computer, poor posture, I'm sure, because, I'm on the laptop a lot. And so that was always just very frustrating because I would do acupuncture, go to colleagues, get acupuncture, try to give myself self-massages just to kind of help out with that tension, and it never really helped. But the one symptom that was really debilitating was just getting severe electric cramps just coming down my neck, and that would happen pretty frequently, several times a week. And if it was a good month, then maybe a couple times a month, but nonetheless, they were pretty severe. The other thing too that I noticed is even driving, I wasn't able to always completely turn my head to look at those blind spots. So that was always kind of frustrating as well. Not saying that it was dangerous on the road, but nonetheless, you have to put a little more effort on completely turning a little more around. So that was another frustrating thing that I saw. But in all reality, the cramps were the ones that were probably the worst symptom that I had, just because it would stop me dead in my tracks when I would have these cramps come up.
You also noticed that you had some head forward posture, right?
Yeah, and so when I was in medical school, one of the things that we did learn is also how to, adjust individuals. And so my classmates were the ones that I had noticed that, I always had this forward carriage, which is basically my head a little more forward, which probably also added a little more to that tension, just because we know when, you're off the center of gravity, then your head becomes a little more heavy for your spine to carry. So that definitely was something that, would make my posture not as good as I would like, is having that forward carriage.
Now, you notice we're live here because the computer went into its sleep mode, so we're pulling it back up again so we can look at these images. So it always happens when you're live, right? So anyway, we've pulled up the images we want to go over, and these are kind of the before and afters at this point. So this is Dr. Carmel's first x-ray a year ago when she came to see us. And, well, probably not quite a year ago. It was a little bit after that you started. But anyway, we look at this, and we see that there should be a normal curvature that goes this direction. Center over the center of gravity. Nice 40-degree curvature. Well, if you look here, she's actually reversed through the middle. And overall, when we measure top to bottom, there's only a 3-degree curvature. But when we measure the vertebrae that are angled at the center, that's a -9 degrees. -9 is a real problem. So with time, this forward curvature will increase, what we call an increase in the kyphosis of the neck. So that will get worse with time. 30 millimeters in front of the center of gravity, and then we only have an 8-degree angle to the first cervical vertebra. That's a problem. And so she began, and what we did with treatment is we use chiropractic adjustments. We also use what's called a mirror image adjustment. That's a chiropractic biophysics term. It's a different type of adjustment that's necessary to actually get change in the curvature of the spine. And then we do traction. Now, traction is a device that we use to put weight and stretch the neck, or stretch the ligaments in the neck, so it begins to adapt and change back to its normal posture. And then there are therapies or exercises that we can include in that program. So let's take a look now at this next x-ray, and this is the one we took most recently. Looks like February 9th. And what we have here is a change, first of all, in the curvature. We're still a little flat through here, but we start to get more curvature up high. Notice that it's not curved forward anymore. So the overall measurement before was 3 degrees. Now we're up to 18.8 degrees. So that's a nice 15-degree change in the curvature. Do we need more? Yeah, we need a little bit more still. Normal is 40. Anything over 32 would be stable. So we do definitely want more. The angle of the first vertebra was only 8 degrees initially. And so now it's also up above 18 degrees, which is a nice change as well. But what we see here is that we're still around that 30 millimeter mark as far as the anterior head posture. And so now it's time to modify the traction a little bit, and we're going to add a little bit additional weight in the traction to the head to begin to allow it to bring it back over the center of gravity. So when we do the next follow-up x-ray, what we expect to see is an improvement or a further improvement in the curvature in the neck. The angle of that first vertebra should continue to improve up closer to 25 degrees. But what we'll see is the center of gravity beginning to come back closer to where it should be balanced. And that will continue to make a big difference in how you feel. So share with them how you felt since we've done this and how you're doing now.
So I have to say that first week of traction, I was floored because I felt like all of a sudden I grew taller, and I'm pretty short, so it was very exciting. I'm like, I feel tall. But also I've noticed, and I didn't really give it much thought until now, when we were kind of looking at the case, I'm like, I haven't had those electric cramps that would just kind of stop me dead in my tracks. I haven't had those at all, so that's really nice. The tension on my neck has also gone away, even though I'm still on the computer, not probably more than I was before, but still not a problem. Now I notice that it's easy for me to like look around my sides, you know, for my blind spots, so that's also a nice thing. So there's a lot of improvements, and it's very encouraging actually to see the numbers, just because, you know, I like looking at numbers. I like seeing, you know, the results, and it just makes me say, hey, you know, I still want to keep up with the traction so then I can get better results.
Exactly, exactly. And that's the truth of the matter. You know, a lot of times people are motivated to start treatment when they're in a lot of pain, right? Things aren't going well, and then as they start to improve, they start to lose focus on their traction or on their treatment. And this happens with, I think, any type of health care. When the symptoms are gone, the motivation kind of goes with it. And so what you have to understand is that even though symptoms go away, and we want them to go away, the ultimate goal is to restore the normal spinal configuration, get that curvature back in there, so that not only do you feel better now, but years and years down the road, you continue to have a normal function and no symptoms. So although we can't guarantee more height,
Too bad.
you know, we'll get you playing for the Utah Jazz if we could do that. But anyway, we're going to continue to work on this neck and get further improvement. It's important to notice that, you know, not only do we take an x-ray at the beginning, about halfway through we take an x-ray, we decide if there are modifications to be made to help us get a better outcome. And then at the end, we're going to take it again and make sure that when we look at the number of visits that we plan on having, that we've accomplished what we needed to accomplish, so that we know it's not a guessing game. It's not, hey, how do you feel? Well, I think I feel okay. Well, we must have changed something. Let's approach it scientifically. Let's take an x-ray, do the measurements, and make sure that things have changed. Once that neck is stabilized and normal, it'll stay that way for years and years. So that's what we're after, is a change that is long-lasting. So I appreciate the fact that Dr. Carmel is willing to share her case in public. Most of the time we'd have to go in and cover up a lot of markers and things so nobody knows whose it is. So she's been willing to share that, and I appreciate that. So we've done good, and we're going to continue to do good.
Yeah, I was just really excited. I'm like, everybody has to see this, because I'm sure there's other people that could benefit. So I felt that it was only, you know, good to share that information.
Yeah, most definitely. And, you know, we talk about neck pain. We can also include things like arm numbness, tingling, weakness in the muscles, headaches. Those kinds of things are all controlled by what's going on in the neck. So give us a call here at Elevation Health, 801-974-5555. We're located just down the corner of 6200 South and Redwood Road, right off of the freeway here. And we'd love to help you. If you have questions, call. I'm happy to pick up the phone and answer your questions. Let's get you down here. Let's do a thorough examination and find, you know, take the x-rays and find out what the problem is. And then we can address it properly so that we have a successful outcome at the end. 801-974-5555. Dr. Gary Lee, Dr. Carmel Ferreira. We'll see you soon.